we really have two major choices for people with a good performance status, either FOLFIRINOX or gemcitabine and Nab-Paclitaxel. And yes, I would say there has been a change in approach to the disease. Both options now are well recognized and I would say widely utilized. But given that we have an emerging standard in a second-line setting, increasingly people are thinking, what choices should we use up front to maximize the sequence options over time? So to a degree, that probably is biasing the community towards gemcitabine and Nab-Paclitaxel. And I think there's been a very steady uptake here. And that may also be impacted upon by patients' increasing comfort with this regimen. It has some attractions. It's a weekly regimen as opposed to FOLFIRINOX, which is bi-weekly, requires a Mediport. Patients have a home infusion, which for some can be inconvenient and awkward for them. So that is a factor in terms of choices. I think other factors that influence people's choices would be issues of alopecia, for more with one regimen than the other. Issues of neuropathy may bias towards one regimen versus the other. Liver function, so for example, a very common scenario is patients who have elevated LFTs and we're waiting for improvement in liver function following stent placement. And that, at least initially, curtails the use of certain drugs until liver function improves, and that might sway us to use one regimen versus the other in a modified format initially.